So the second part here is sector-wide innovation. Here, you can do shared services across your whole sector. The banks, for example, the big banks have a clearinghouse for checks together. They have there's a company, SimCorp, that runs a lot of back office operations for all the banks, and they're much more efficiently, and their cost structures go down. You can do that across your sector. You can also look at coordinating, I think, as well as how you operate your system, coordinate how you do your outreach, how you do your advocacy, how you present yourself to the world, to government and to others. And there's, especially if we go forward and we see an innovation strategy, which is the thesis I'm presenting to you today. There are a number of pieces. Time doesn't allow me to go into this. You can do, we've got some examples of programs that are designed to prepare the health workforce to care for older adults, things that you can do across your sector, which actually, rather than waiting for outside the sector for action, if you want to innovate to become delivering a higher order services, you can have a people strategy, and this is being done in the States, in Norway, and elsewhere, and there's some examples in the report that you can build on. And I'm sure there are more out there, but it gives you a flavor of what can be done around teaching, for example. So that's two areas. The third area is innovation for integration, and that means expansion of existing services, connecting those services across the whole healthcare sector, also creating integration with education and perhaps with the hospitality world as well. I think there are things that can be done, outreach experience opportunities there that would be significant. Some of the possibilities we've looked at, extending respite care, dementia care, the education and support stuff I mentioned, and there are a number of other ways of doing this, but perhaps sort of strategically, the biggest idea is that if you think of the whole system, and right now you're a piece of that system because of what you do, you could revisit that system and restructure it and proactively kind of seize or at least advocate for a bigger role in it. And I think that's a crucial thing to think about over the next medium to long term. It's not a thing you do overnight, but it's an important opportunity for you. And we mentioned some of the sort of things that you can do, by the way. There are these mini med schools that a model that we think you could take and create ways of building. You've got to build a public understanding of what you're about, what you're doing, and generally a bigger understanding of aging long-term care. Interesting, I think one stat I saw, only 1% of the time in med school, for example, is spent on geriatrics. But if you look at the amount of time that physicians spend with older people, it's a very substantial proportion of their time. So the structure of our system in the acute care world, in the GP world, the pre-service training, if you will, of the system is actually not well structured to raise awareness and capacity, not only inside it, but of course beyond it to the general public. So doing some of those things would be helpful. We have been looking at innovation for quite some time at the Conference Board, and this is part of, so how do you get there, in other words? There are some things to think about, some principles to apply, and I want to just share a few of those. How do you actually get innovation happening? We've been doing this at the national, sectoral, and firm level for at least for 20 years, and there are indeed some barriers. I'm going to highlight a few things that are preconditions. First one, actually have a vision. You have to have some clarity about what you want to accomplish. You do not need to start with knowing how to do it. You have to have an idea of what you want to get. It doesn't have to be granular, but it has to be big and bold. And then that's a starting point. And from there, objectives about what you're doing and what your priorities are, because you certainly can't do everything. Second piece that falls out from that is having resources. A lot of people actually start by saying, we don't have any resources, so we can't do anything. This is a common comment in sectors. It's actually not the place to start. It's not, do you have the resource? It's, what do you want to do? And then you find your way to the resource. And that's an important change in mindset. It's not that this is a trivial thing. It's not. But you can't get there from here if you start with resources. You have to start with vision. Leadership. we have a leadership institute at the Conference Board, Niagara Institute. I have people doing research on leadership. Leadership is a huge piece of this. It actually is a courageous thing to be a leader. Those who are not leaders, and leadership, of course, occurs at many levels in organizations. A lot of people like the idea of being the leader, but they don't necessarily realize the amount of pressure involved in that. I prefer here to stress the opportunity. Leadership means people who have the kind of the vision and the nerve to act, the will to act, motivate people, find the resources, and get it done. This is the part that you may need to actually work on leadership. I've certainly worked in other sectors of the economy where there was a need to build leadership capacity for change. Because if your leadership has been selected to be very good at operating a system, it may not have the skills to change that system, or yet. Doesn't mean they can't, but you may need to work on that a bit. Human capital, of course, you need, it's typically measured by educational achievement. I don't think that's a perfect proxy for capacity, but it is important to have a well-trained, skilled, and motivated workforce, and building that up. That's a precondition. I think it's also something you can build on in your strategy itself, because a supportive organizational culture, the guy who found the $7 million I was on stage with another guy who was president of a large hotel chain, and he was inspecting the bedrooms with his EVP, and there's the lady who was doing the room, and she said to him, I think she knew he was the president, but she said, "Why do we have so many pillows on the beds? We don't need 6 pillows, let's go to 4. And she gave him a little lecture about how annoying it was and so on. Well, they changed that, and they saved themselves a great deal of money. He didn't quote the exact amount, but he was smiling. Thing is, she felt okay about speaking to him. He said thank you. They did it. They didn't just sort of ask for advice and then not do it. They actually did it. And I think creating that kind of supportive organizational culture is huge. 6th, competition is a nice driver. Necessity is the mother of invention, and competition sometimes creates that necessity. So that's not a bad thing to be in competition. It's a good driver. The final precondition, you must collaborate. You must have networks and alliances, and that should reach across from the sector, across health, to other parts of health, to education, to government, and that whole piece of connection has to be tied into reward and recognition. So, all right, those are preconditions. Here's a few of the barriers, because having those preconditions in place definitely helps. So what's the problem, you might ask? Well, we did a survey of 222 leaders in Ontario, and we were in another project, and we were talking to them about what's the problem with innovation in your sector. So this is not in LTC, but it is leaders in Ontario and about barriers. And it was interesting that a heck of a lot of people, nearly 90% said, hey, innovation is important, or it's really very important. So they all know it's important. Keep that in mind. Then we turn to say, so what's the problem? And then we have this list here. Well, there's no money for research and development. We don't have enough time. Our organization's not big enough. We don't have expertise. There aren't enough incentives out there, etc. So there's lots of reasons, and good reasons, why people aren't innovating. So these are not trivial things. This is reality for people. So what do you do about it? Here's, in particular, for the long-term care, here's where we think there are issues. At least there's identified concerns. One is about regulatory barriers. Secondly, time, resources, lack of expertise, and negative perceptions about the sector are the top 5 we saw. All of which can be addressed, but that you need to know what they are in order to have a strategy to address them.